We have on the line Dr. Derek Cheung, member of the University of Hong Kong Smoking Cessation Research Team, and Dr. David Lam, medical sector lawmaker. Good morning, Dr. Cheung.
Good morning.
And good morning, Dr. Lam.
Good morning, Jen.
Thanks for joining us on the program. Now, and Dr. Cheung, and the consultation document, of course, it contains many different suggestions. Which three, in your view, are the best ones?
Well, I think the critical moment for the government to launch this consultation, I think the proposal covers several effective and evidence-based policies to further reduce the smoking preference. I think the very first important thing is to increase the tobacco tax, which has been shown very effective measure to further reduce the smoking preference.
All right. And Dr. Lam?
Well, many measures over there are quite useful, and it's very hard to pinpoint which is most useful. But as the professor pointed out, there's a lot of studies worldwide showing that increasing tobacco tax actually helps to encourage people to quit smoking. But another measure which is quite important is really to draw a line after, the birth date after which they should not be allowed to purchase tobacco products legally even when they grow up, because we do not want new smokers. So the increase in tobacco tax encourages people to quit smoking more, and then you draw a line that just to inhibit new smokers from coming into society. So I think that is also useful.
Dr. Lam, I think we might call that the New Zealand solution, mightn't we? Because New Zealand's the first major jurisdiction in the world, as far as I understand it, that has adopted that. But New Zealand's still very much in a minority. We're not seeing that in large numbers of other countries. And if we look at that proposal where the government puts it forward in the consultation paper, it's in very tentative terms. And you can imagine that there'll be a lot of opposition to that.
Yes, of course. There's I still remember someone said it's a Newton's third law. So for each action, you have a similar and opposite reaction. So it is true that there will be quite a lot of opposition. But if that is the correct way to go, then we have to go for it. Who in this world wish their own children, to become smoker when they grow up? That's just the question. Even if the parent himself smokes, I think very, very, very few of them would wish their children to become smokers when they grow up, because everyone knows, it is really common sense, that smoking is hazardous not only to health, but also dangerous to our life.
Right. Dr. Cheung, what's your thought on that? Yesterday the Health Secretary, he said the government wants to find out whether it's suitable for Hong Kong. Do you think it's suitable for Hong Kong?
Yes, I think so, because I think that the also effect of these policies is try to denominize smoking, because we still see many people in Hong Kong in the streets, outside, plaza. Still many people are smoking, and it is also exposed many people, many young people, children exposed to these smoking things. So I think the measures here to expand, to increase the age of buying to purchase tobacco or expansion of smoking-free area, all these measures try to denominize this smoking behavior in Hong Kong, which is also important for us to further reduce the prevalence of smoking.
Now, there are a number of press reports that suggest that there were other proposals as well that didn't eventually make their way into the consultation paper, including requiring shops to have licenses before they can actually sell cigarettes, and requiring anyone who's purchasing cigarettes to use a government app to verify their identity. Dr. Lam, what do you think about those kind of even more radical proposals?
Well, if you want to buy alcohol in the United States of America, do you have to produce your photo ID? I think you have to. So it's nothing very draconic. It's quite normal. If you want to buy something, the law requires that you reach some age, so you have to show you are. It's simple. Well, why are we having an issue with that?
Well, it's not even been put forward as a proposal for consultation, so it must have been considered that there were some problems with it in Hong Kong.
No. Now, we must understand that most new smokers start before they reach the age of 18, usually school students when they start smoking. So if you increase the age limit for allowing them to buy cigarettes, then that helps, because very few people start smoking after they reach adulthood. So it is useful. It is also evidence-based.
Now, the vast majority of our smokers are older generation these days, aren't they? I mean, I know people are still concerned about smoking by young people, but the percentage of young people smoking is tiny compared to the older generation. So how is having these restrictions on younger people really going to address the main problem at the moment?
Well, I mean, if there are so few people taking smoking when they're younger age, then the rule or the new rules is not going to affect them very much because after all, they're not using the product, so it is quite an easy way of preventing a resurgence of a smoking habit. You never know. I mean, it's nothing fashionable. We all understand it is nothing posh. It is hazardous to health. It kills people. It is carcinogenic. But then the way they are packaged makes them feel like they are fashionable, and then they come with new packages and new flavors, and sometimes they have the ways of making it appealing to young people. So before they have new attractions, then we must just draw a line. No way. You can't buy it.
So restrictions on young people, if there are relatively few young people smoking, it's not going to affect them so much. But at the same time, it's not going to do so much to reduce smoking in Hong Kong if most of our smokers are elderly, and also particularly the health problem, the chronic health problems that come with smoking, which you see in the older generation. So it's a slight problem there, isn't there, Dr. Lam?
Yeah, that's why different proposals has different purposes. So the proposal of increasing the age for buying cigarettes is not for the elderly people who have been smoking for 50 years. For them, the most important way is to reduce the content of nicotine in the smoke and try to help them quit smoking.
Right. I want to go back to Dr. Chung. I mean, earlier you said increasing tobacco tax is one of one of the options that you think it will actually be most effective. And now we're looking at maybe increasing the tobacco duty to around 75% as recommended by the WHO. Do you think, I mean, if we do that, do you think it should be done rapidly or gradually every year?
Well, actually, in most of the places in the world, many countries have do this implemented, continuing increasing the tobacco tax every year or every 2 years, and this is a very effective measure to reduce the smoking preference. And actually, in Hong Kong, we can see that in past 10 or 20 years, the pace of increasing tobacco tax is very slow. We have once increased in 2009, 2011, and then 2014, and then after 8 or 9 years, this year, 2023, we have just small increase. So a very infrequent increase in tax, and also not following, the inflation of Hong Kong. So the affordability, that since people are the tobacco product is still more affordable for the Hong Kong people to buy. So I think it's not very rapid to increase tax every year. So it is actually a very effective measure.
Right, but do you think it should be done all in one go? I mean, should we increase the tax to 75%, for example?
Well, I think government should also have to concern about people's acceptability about this rapid increase. But I think what I'd like to point out one thing is that 10 years ago, 2009, we increased by 50%, of tobacco tax, and the increase in the reduction in preference is very, very large. But when we have very small increase in tax, people still don't feel the impact on them. So I think the government needs to balance. We should not reduce by too small proportion in one go. But maybe in long term, we should increase maybe step by step, increasing every year. We need to do this.
What about the impact on illicit cigarettes? I mean, would it worsen the problem, do you think? I mean, if we increase the tax by too much in one go?
Well, I think illicit cigarette consumption is one of the issues people concerned that they think that the increase in tax will lead to more illicit cigarette consumption or this market. But I think we need to really think about the tobacco impact to Hong Kong. I think in the proposal has also mentioned that actually $5.5 billion of loss every year due to tobacco. And also, I know that it's not just from the news, but also from our data, our survey data showing that not all smokers are opposed to this tobacco tax increase. Many people also said that when the tax increase, they will have more motivation to quit smoking, and they won't change. They won't use these illicit cigarettes. They want to quit actually, but they need a push by the government to do this.
Let's go back to Dr. David Lam on another of the proposals in the consultation paper, which is suggesting that there should be a ban on smoking and walking. I mean, for non-smokers, which is most of us, certainly it's a great annoyance when you have someone walking nearby who's smoking. But I'm not really sure how this would work. I think it's mentioned, isn't it, that if there's a ban on smoking and walking, then somebody can just stop walking if a control officer comes up to them. Dr. Lam, what are your views?
Yeah, you can draw 150 circles in Hong Kong and you can only stand there and smoke. Otherwise, you are against the law. I think it's just part of the big picture. And now, there are rainy days, and if you walk on the street on rainy days, either you walk into the rain or you'll be following someone who is smoking, or you walk under balconies, and there will be a line of people smoking around you. So that breaches my freedom of not smoking. Okay. So now people who walks and smoke, the problem is with like people who don't run, elderly or children, young children. If they follow that person for say 100 meters, then over that period of time they'll be smoking the secondhand smoke. So it is not fair to them. That's why if there's always been a discussion of that people, if they want to smoke, they just stand there, do not walk around. Otherwise, they'll be spreading smoke. And people who follows them will have to are forced to smoke. But then it is all about force and law enforcement. I think it is very difficult to enforce. Although I would still suggest that we seriously consider that. But going back to the issue on tax, the cigarette tax is a very abnormal type of setting. If you look at private cars, the tax rate, there's a tax rate, and it is pegged to the car price. But for tobacco, no, it is not tagged to the cigarette price. It is a fixed sum of money for each cigarette stick. So I think if we peg that to the selling price of the cigarettes, then it works better. And you do not really have to go to the Legislative Council and ask for a hike in the tobacco tax every time. Say if we keep that at 75% of the overall selling price of all cigarettes, then it's easy.
Right. So if, according to the proposed tax increase, for example, 75%, it would make the current price of cigarettes, which is at $74 right now, to approximately $100. Do you think it would discourage people from smoking?
Yes. There are studies and predictions from academics. I think Professor Chung knows more about that predicts if we increase the selling price of cigarettes to over $100, then more people will quit smoking, and we stand a better chance of achieving 7.8% of smoking in our population by 2000. It's 2 years from now.
Let's ask Professor Chung about that. $100 a packet of cigarettes?
Yes, actually, this is not. We did actually do the survey with the COSH, Hong Kong Council on Hong Kong Smoking and Health, and we see that actually not all smokers are opposed to tobacco tax increase, and a portion of them actually they would say that I think around more than half of people say that they will either quit smoking or reduce smoking when the tobacco retail tax increase to $100 or even more, and we don't see that actually the proportion of converting to use illicit cigarette will increase like this proportion. So I think actually when you want the smokers to really feel the impact of the tax increase, I think the retail price needs to be concerned to be increased to up to $100, I think.
Okay. Dr. Chung, one thing really struck me in the government consultation paper, talking about the health problems associated with smoking and the burden on society, said that the increase in chronic disease among the middle-age group is even higher than in the elderly population in Hong Kong, and that means that we're going to have, and of course not all chronic disease coming from smoking, but smoking contributing quite a bit to the chronic disease.
Well, I think the government actually put a focus on the aging problems linked with this tobacco problem, the tobacco issues. And we see that actually tobacco actually leads to many kinds of diseases, cancers, cardiovascular diseases, COPD, and so on. So many health problems due to this tobacco. So I think, actually, people when they get elderly, they have a longer smoking history. It seems we see that they will find it difficult to quit. So actually, I think the proposal we want to see is not only targeting on those older people, but we want young people when they are not too addicted to tobacco problems, tobacco addiction, they can quit as soon as possible, so that they will to quit easily, more easier than those elderly people.
But why would it be the case that the increase in chronic diseases is even greater among middle-aged people rather than elderly people? You'd expect elderly people to having the greatest increase in chronic diseases.
I think those health problems are going to happen. Where people are smoking, maybe middle-aged people, the health impact, the health problems not being shown in just 1 or 2 years. But after 5 years, 10 years, when they go into an older age, the health problems will appear. Those chronic diseases, including diabetes, lung cancers, and all kinds of problems. So I think middle-aged people should also be the target to quit smoking.
All right. I just want to go to one of the suggestions in the consultation document. It's about the fixed penalty, which is set at $1,500 right now. And in the consultation document, it's suggesting that a higher fine of maybe $3,000 or $5,000. What's your view on that, Dr. Lam? Is it necessary to go up to $5,000?
It's a deterrent effect. Depends very much. I think any deterrent is useful, and a higher deterrent, higher the fine, the bigger the deterrent effect. And if you increase that to 5,000, which is similar to a slightly more serious offense, then that is certainly more useful. I would certainly think 5,000 is more useful, and we should look at that as the aim. Now, going back to the question why we may have a bigger increase in chronic disease in the relatively younger or middle-aged people rather than the elderly, I think that is just the result of a modeling. And if we are going to answer the question of why, then these are just proposals. One possibility is that people who live to the old age, they have already proven themselves to be more healthy.
Oh, right, yes, of course.
Yeah, but the younger ones, especially in these days, if you see some drivers who sit in the car all day long, never do any exercises, they would have high cholesterol, they would be overweight, they have high blood pressure, and maybe a lot of them have diabetes. So we expect lots of increase in chronic diseases in that particular age group. And some of them may not make the way to old age. So by, say, 70, then the chance of you having new diseases is still there, but probably the increase is lower, the acceleration is lower than when you are slightly younger.
This is slightly beyond the scope of today's discussion, then, but you can say that Hong Kong has in terms of the much more elderly generation, has a relatively healthy population, doesn't it?
Yes, we do. And partly that's because when they were young, let's just talk about 20 years ago or 30 years ago, then we are not just affluent as today, and people eat less meat, more vegetable, and possibly they do more exercises at work at least. So things are changing, but we do expect a longer survival. a longer age of living for people, even younger people in Hong Kong, which is optimistic.
So we are facing almost a health time bomb, aren't we? And smoking is not the only cause, but smoking is one part of it.
It's not the only cause. It's not the only cause, yes.
Okay.
But if you look at the number, it increases. The burden on economy is great, and the burden on healthcare is also great. So it is not only about a personal problem, it is also a society problem. 5.5 billion economic loss per year, 7,000 life loss per year for Hong Kong only. So not talking about the loss of workforce, so it's a big problem. So it's not only a personal issue.
Let's return to the issue about what you were discussing just now. You were saying that you favoured increasing the fixed penalty fee, and even that $5,000 would be okay. And I understand the public health reasons for that, but still, if we look at other fixed penalty fines, that's really there would be a huge disparity. And from memory, illegal parking is about $300. So are we saying that smoking a cigarette is 10, 15 times more serious offence than illegal parking? And there'll be many other examples which where the fixed penalty fine is only a few $100s.
Yeah, but you don't cause health hazard to people around you if you.
Well, you can cause safety hazards. I mean, it can be very severe safety hazards. So you can have traffic accidents.
I do remember when during the pandemic, the COVID-19 pandemic, when we implemented the mask restriction, we want people to wear masks in the street. If they don't wear this, at the penalty, it's up to $10,000 actually. So compared to this restriction, I think $5,000 is quite threatening and not too high, not too high than 10 mask restriction.
That is a good comparison, actually, because, of course, the fixed penalty during COVID was also for health reasons. I mean, more immediate and severe, but nonetheless, that I suppose that does make the argument. So it's justifiable to have much higher fixed penalty fines for health-related reasons. Is that what you're both saying? Dr. Chung?
Well, I do actually think that $5,000 it would be show a bigger impact to these people not to smoke in this non-smoking area, and then it is also about our health, about our we want people not to do that. So it's not really. I think it's not too high compared to that mask restriction penalty, fixed penalty.
On the other hand, we have to think about the impact on low-income groups. I mean, it's when we had those fines for masks. I mean, there were a lot of stories about Filipino helpers, domestic helpers being fined a month's salary and things like that. I mean, I don't think that means domestic helpers smoke, but you can imagine for low-income earners, you can wipe out a substantial amount of a month's income with a fixed penalty like that.
Yeah.
Is it fair, Dr. Lam? Is it fair on lower-income earners?
I don't see too many domestic helpers.
As I said, not domestic helpers, but there are plenty of other low-income earners who are not domestic helpers. So.
Yes, exactly. So the way to get around it is to really help them quit smoking so that they have more healthy life, and then they have less diseases, and then they have more disposable income. Isn't that fair? I mean, why do they have to stick to a hazardous habit that is going to pull up their health when they get older? And if that's going to make them retire slightly earlier so that they have less to spend when they become old, that's not fair to them. So I think it is only fair that we try all measures to encourage them to quit smoking as soon as possible, therefore increasing the availability of quit smoking services, and perhaps more free quit smoking services will be very useful.
All right, Dr. Lam, I'm afraid we have to take a quick break for the news. Thanks again for joining us this morning. That's Dr. David Lam, medical sector lawmaker.